All right, so welcome to the practice. Okay, so what can I do for you today?
Well, I have a lot of pain in my lower back. Also, I have a lot of pressure in my right ear. It feels wet usually almost every day, and there's also pain in my ear. And I've experienced vertigo and like dizziness before. I've actually thrown up because the world starts spinning, and yeah, a lot of pain.
So it feels like there's fluid in the ears?
Always wet.
All right, and you also have ringing in the ears too?
Yeah.
Okay. And also, have you had any hearing loss yet?
I'm not sure about the hearing loss but I do prefer listening to my, but I'm not sure. Yeah.
Fair enough. Sure. Because actually, the symptoms you're describing is actually Meniere's disease, right? So that's what happens when there is a chronic fluid buildup in the ears, and eventually it disturbs the cilia in the ears, and that's where it causes a ring in the ears, and also that vertigo, all that vertigo attacks. And okay, so we'll take a closer look, see what's going on, and we'll take it from there. Okay, so right off the bat, what we see is here. There's a lot of swelling, a lot of muscle spasms on the left side. See it over here? Not too bad on the right side. We do have some swelling over here, tracing down here. It sinks down right here. That's a pinning edema at this level. And we've got another pinning edema sinks right here. Tracing all the way straight down. And I'm also feeling at the same time the muscle spasms. So something's at this level here. Not too bad in the pelvis. So something's going on over here. So now we use this instrument. And we're tracing along, as we mentioned before, if there's anything that's damaged, it's going to cause an inflammatory response. We found one level there. Scan the rest. We've got something, a very small one over here. See, we have another reading quite a bit there. And we have another one here. Okay, so I'm looking at the x-ray, I'm overlaying the data. I'm using it like a blueprint, like a framework, and I'm seeing a potential here. We're gonna roll that out. See, there's a little fixated on the left SI joint. Not too bad on the right, which is interesting enough. So this might be a false positive. But this fifth lumbar is very posterior inferior. Tendon right there, huh?
Yeah.
Yeah, see, that's not moving at all. So there's that fifth lumbar right there. See, biomechanically, this is not adapting to well. Pain right there, huh? Yeah, that's your sixth dorsal. How's this? Tender? Not too bad, huh?
No.
Yeah, see, it's stuck right there. You feel this huge knot right there? Mm-hmm. Yeah, that's a fifth cervical right there. And that's what I'm seeing in the x-ray as well. This is very swollen here. And how's this fellow right there?
No.
You feel that big knot here too, right? Okay. Yeah, there's that fellow. So let's break it down what Meniere's disease is, okay? So we have the inner ear. We have the vestibulocochlear nerve. Now, based on earlier, we had a consultation in the history. You talked about, says, okay, you're in a car accident where you guys hit the pole, and as a result, you impacted on the right side, right? And then ever since, you've been having some neck problems on that side too, right? So, and even the airbag deployed, and you even have a nice little interesting scar.
Right side.
Yeah. Okay, so, and ever since that on, you've been having all these symptoms, right? So now, what Meniere's disease is all about is this, okay? We've got the inner ear, the vestibulocochlear nerve, but Meniere's disease is like the perfect storm. Everything has to occur just at the right, perfect amount to make all this stuff happen here, okay? So the very first nerve that actually gets in trouble is a trigeminal nerve. So why is this important? This nerve innervates the very roof of our mouth, the soft palate. Okay. Now we do have a eustachian tube. Okay. It drains the fluid from the ear, and you can actually see it if you lift your lip up. There's an exit hole here and an exit hole over here. So the fact that you said, oh, I have no problems with the left ear and it drains just fine. So left ear and the left soft palate, that's fine. But the right side is all filled up with fluid. So that tells me the soft palate on the right trigeminal nerve, that's not working right anymore. So therefore, the roof collapses, impacts and pinches right onto the eustachian tube. It cannot drain properly. Therefore, all the fluid backs up over here. And because we have all these ciliaries over here, all this fluid, it messes it up. So that's where you get this, oh, okay, you got this ring in the ears, and also this, what the heck, I got this vertigo, everything's like swishing in motion like this. Even if you're laying on the floor, don't move at all, it still feels like you're in a nasty, the seasickness in the middle of a hurricane, okay? So what's the real answer over here? Because once these things go all haywire, that's how it starts to affect this vestibulocochlear nerve. The real answer is actually nothing to do with this. It's actually, we gotta address the trigeminal nerve. We have to restore the nerves to get the soft palate to take the pressure off of this eustachian tube, let it drain out. And in addition to, we also need to get, by the way, the trigeminal nerve, usually the innervation is usually around this area. Yes, even though while it does come out from here, there is parasympathetic, sympathetic, the nerve fibers, still, it's around this area down here. But there's also another fun part, is that upper part that also still helps and deals with the drainage as well. So we're gonna touch base on that on the x-ray. We'll take it from there. With the Meniere's disease, usually there's two areas of spine we're focusing on, and also their nerves as well. The upper part of the cervical and the lower part of cervicals. Now, what already caught my eye right off the bat, okay, fits cervical over here. Everything else, it's kind of decent discs, but I see a nice little oval ball shape on the back part over here. And when we look on the AP view, this part's turning this way, and then from here, it tilts opposite direction. So just like that liquid ball bearing, the nucleus pulses, okay, we want to see it bounce like this. However, because it's shifted over to the left side, it's causing everything else to tilt this direction over here. So that's why it's imperative we have to address and push that liquid ball bearing back in the middle to realign this one. The other component is also over here, okay? Now, it may not look like the second cervical is inferior, but when we take a look at the facet plane lines, we see over here, see that? There's a nice little black shape, okay? A black hole over here, black space over here, black space, but there's nothing here. It's completely bone is touching on bone. To explain over here, I want to see it like this. Everything, so far, everything is like that. But when we reach the number between 2 and 3, it's like this. So whenever I see no space over here, even though it may not seem too much, this is inferior, no, that is definitely inferior. There's no other way to make that imbrication unless that bone itself, the vertebrae, is tilted backwards like this. That's why we have to address that fellow. Now, that being said, we're going to trace all straight down. How's everything else coming along? Well, we have this old compensations that turns subluxation over here, that 6th dorsal, that's why it's causing all this to turn around. So even though we adjust this fellow over here, how long can that all your symptoms for Meniere's disease stay put? It's going to have a tough time doing so. So that's why we have to level this out. I may need to level this one out as well, 2nd dorsal, but take it all the straight down. We also got the 5th lumbar. This 5th lumbar over here is posterior and tilting backwards, inferiorwards as well. Now, during examination, I touch base and I said, hey, wait a second. The left ilium seems to be fixated, but the right side is not. So that's why it's very important to collaborate and make sure all the data says like, okay, this is the fellow, this is the fellow, this is the fellow. I believe we have a false positive with this one over here because why? Biomechanically speaking, when I see this whole entire pelvis is sinking out this way and rotating this way as well. In other words, your whole entire pelvis is going like this, and that. So if it's doing that way, well, here's the thing though. The body, biomechanically, naturally wants to re-level itself here. So therefore, there should be something to be stuck and not moving here. It's not, it's moving completely fine. So that tells me, that's interesting. Most likely, then we have to check further up. Are the nerves that supplies nerve function to the hips, are those working? This fifth lumbar is not. So that's why it's irritating. It may not be causing a false positive on that one. You know what? Another drop. Okay. Now we're gonna get this one. Right, this spot right there.
Actually, I felt like I could breathe a little better on
Okay.
this one.
No, that's a good start. Okay, we're starting to get some nerve function, so to get in there. Because by untwisting your spine a bit, it's taking some pressure off of that trigeminal nerve over here. But more importantly, how's the fluid in that right ear? Do you notice anything different in there?
Kind of hard to tell.
Okay. There's usually 3 common reactions for Meniere's patients, okay? Either A, you're gonna feel like there's a huge waterfall gushing down the back of your throat. B, it's gonna feel like a trickle, okay? Or C, it feels like you need to cough something out, but you have no idea what you need to cough out. Okay, it's that small. We usually expect this within the next 36 to 48 hours. If you want to speed things up, I recommend get a nice steam bowl, drape your head with a towel, breathe the vapors in, so it will loosen up all that junk in the Eustachian tube. Let everything drain out. Okay. Okay, so we'll see you the next appointment. Let's see how everything's coming along. Right? Okay. Give us the latest updates. How's everything coming along?
Everything's pretty good. I mean, I kind of relearned my balance from everything. I felt a little drainage come down. Like while I was walking home, it started. I felt it right down from my ear. I heard this little sound like in the back of my throat, and it kind of just started coming down. It actually made me a little dizzy, but yeah, kind of regained my balance. And then my sense of smell is like really good. So it's like, I can actually smell things again, which is pretty interesting.
Cool. How much better would you say the smell?
40%. So I can actually smell like when people are smoking pot, or someone's like smoking like cigarettes. Like today I was walking to your office when someone's smoking. Before I would just walk by because it's not that small. Now I'm turning away because it's strong, Even eating, like I can smell coffee, I can smell baked goods, like I'm smelling everything. So it's really cool. Yeah.
How's your dizziness, the fluid in the ears, and also the smell? How's all that coming along?
Smells actually like really good. Like my sense of smell is awesome. It's actually a good thing, but I'm New York City, so it's kind of sometimes it's a little more sensitive. But since I'm a foodie, it actually improves a lot of things. In terms of dizziness, I can say I rarely have any dizzy spells. Yeah, it's almost like never. I haven't had one since. So, and in terms of fluid in the ears, sometimes it depends, but it doesn't really like stay, if you know what I mean. Before it would like stay for like a whole month. So my ear would just be humid for an entire month. Now it's just, only only for like a period of maybe 2 days, and then next day it's gone. So
those are great updates.
Yeah. Okay. Only 2-3 days.
Yeah. All right. Well, thank you for the updates.
Cool.